How do doctors use breath sounds to check for lung cancer? Imagine your lungs as a busy city, with air moving in and out like traffic. When doctors listen to your breath sounds, they are essentially tuning into that traffic to spot any unusual patterns that might suggest a problem. During a physical exam, a healthcare professional places a stethoscope on various spots on your chest and back to listen carefully to your breathing. This process is called auscultation. Normal breath sounds, called vesicular sounds, are soft and low-pitched. They are heard over most parts of the lungs and indicate healthy airflow. But if there is a change in these sounds, it could be a sign of something abnormal. For example, if a tumor or dense tissue is present in the lung, it can change how air moves through that area. This might cause the doctor to hear louder, harsher sounds called bronchial breath sounds, which are normally only heard over the windpipe. If these sounds are heard in the outer parts of the lung, it might raise suspicion of an abnormality like a tumor. Doctors also listen for other unusual sounds such as wheezing, which can suggest airway narrowing, or crackles, which might indicate fluid or inflammation. If breath sounds are absent or significantly reduced in a certain area, it could mean that airflow is blocked by a mass or that there is fluid buildup, both of which can be related to lung cancer or its complications. In addition to listening, doctors often tap on the chest, a technique called percussion, to check for areas that sound dull or more solid than normal. This can help identify if there is a mass or fluid collection. Feeling the chest with their hands, called palpation, allows doctors to detect vibrations known as tactile fremitus. These vibrations tend to increase over dense tissue like tumors and decrease over fluid or air outside the lung. While listening to breath sounds alone cannot confirm lung cancer, these clues are very helpful. Changes in sounds prompt further testing, such as chest X-rays or CORT scans, and sometimes biopsies to get a definitive diagnosis. This physical exam step is crucial in the early stages of diagnosing and staging lung cancer because it helps locate areas that need more detailed evaluation. In summary, doctors use breath sounds to check for lung cancer by listening for abnormal sounds like bronchial breathing that suggest tissue changes, detecting reduced or absent sounds indicating airway blockage or fluid, and identifying wheezing or crackles that point to airway or lung issues. They combine these findings with other physical exam techniques to decide the next steps in diagnosis. This approach is a safe, non-invasive way to gather important clues about lung health and guide further testing, always under the guidance of established medical standards. If you have concerns about your lung health, it is best to consult a healthcare professional who can perform a thorough examination and recommend appropriate tests.